Hello, it's Rafael Gutierrez again, and today I'm going to be doing a video on how to skin a cat. The reason is a cat is usually used in anatomy to show off different muscles, different systems. You can actually use it on every system in a human. You could just use a cat. Reason is mammalian anatomy, while there is big differences in the bone structure and how the bones look, it's usually the length of the bones that are different, and so we can use this. You can use this quite a bit on any class. Now, the first thing that anyone should do before they start to work on a cat is know what the basic structures are in the musculature. And I'm going to use a human model to do this. The other thing that you're going to want to do is you're going to want to, while you're doing your muscles, you're going to want to know your bones. So I recommend going to a tutorial on different bones and where they are, or you can use the book that I have available on CreateSpace or Amazon called Human Anatomy, A Clinical Approach. It's about $20 book, so it shouldn't be too much. Now, I will start now, and hopefully this will be something of value to any of the professors out there who are looking for different ways to dissect. Thank you. Now, I am going to begin with the back of a cat, and so I'm going to show you the back of a human. And one of the things you notice is you can see the big muscle, this one right here is the trapezius, and how if you go deep, you actually see that it runs from outside the lateral part to medial. And so the problem with doing dissections going this way is especially when you're skinning, is you end up tearing certain muscles that you may not mean to. You may actually lift them when you're trying to do something else. So I recommend starting midline in the back and moving forward. Now, if you do go to the anterior, you notice that in the chest area you do have this movement going medial to lateral, not lateral to medial, on the way the muscles go in the chest area. But as you go to the abdominal area, you'll start seeing that they also run in a way where it's actually preferable to go from the back, sides, and forward. The arms and legs we're going to do a little different, and these are actually going to be coming off all the way. So with that, I'm going to start trying to do the dissection. I hope this looks okay. Okay, so first I want to tell you about the tools I'm going to use. The scalpel I'm going to use very limited, and it's mostly going to be on the skin. Sometimes you will see me turn it around and use the blunted end of it. When you know the scalpel blade is put in right because of the angle here is equal to the angle on the blade here. Now I'm going to use scissors. Now the way you actually I'm going to tell you to use scissors is put your ring finger in there and your thumb, and so when you cut, you actually sometimes won't even have your thumb in there, but you'll be able to break down. You're usually going to use them the opposite way. So you have two areas that you want to separate. You put your scissors inside and you open it. I do have two pairs of scissors and some rat tooth forceps, and these will help out. Now, one thing you'll notice is there is a large space that I'm going to use. So you'll see how I skin, and hopefully this works out for all of us. Okay, so here's a cat. What I'm going to do is I'm going to do the cuts back here, and I'm going to show you the basic cuts. Now, again, remember, scalpel is only for skin, the way I teach. So what you'll notice is you do have some movement on the skin. So to start, just cut. Now remember, it's not a pencil, it's a knife, so treat it like a knife. Be very careful when you cut. And start your cut at the neck, so you can open it up. Once you have that little cut, you can go from the tail all the way up
and you'll get a lot of fur on your scalpel. That's it. So now you should have a cut down the middle, which you'll be able to open up. The other thing I'm going to do is I'm going to remove the tail. The reason is it makes it a lot easier. All you have to do is go around it with the scalpel. I'm probably going to talk to it. Make that so you guys can talk, don't worry about it. Now you're just going to cut around the tail. Turn them around so you can see what I'm talking about. So you cut around the tail with the scalpel. You don't really are going to care too much about what's there. And once you can have the movement, you can see a little more, you can grab your scissors and just cut it off. You know, there. That's off. And so you're just cutting between. The reason I take it off is it gets in the way a lot of times. So here you have the tail off. You now can come to the first cut you made. Open it up. Now again, what you're noticing, I'm putting the scissors in here and loosening the skin from the rest of the thing. Now once you actually can see that you have skin only, you can use it to cut normal. But again, remember, don't use the scalpel when if you can, use the scissors instead. And there we start getting the skin off. And you can see it's not really that difficult. It's relatively easy. Every so often, if the skin's too tough, you can grab your scalpel, see how it's tented, and come up. Now you will use your fingers a lot for my method. And the nice thing about this is muscles tend to be better preserved. Now, there are some people who tell you to keep the fat with the skin. I disagree, because one of the things is the connective tissue of the that holds the skin and fat together tends to help you be able to remove the fat as a whole rather than piece by piece. Thanks. Every so often, when you can see more of the cat, you can continue to dissect. Now what you'll notice is just by doing this technique, you're already able to see some of the muscles underneath the fascia. And that will let you go a lot quicker. And when we finish this, I'll show you the front, which is not going to be that much different. Again, remember, I'm not trying to find all the structures for you here. All I'm trying to do is get the skin off. So you can say I'm teaching you one way to skin a cat, right? These are the jokes, people, I'm sorry. But you'll notice the skin begins to come off relatively simple. And you can see the divisions of the muscles if you look closely. For instance, over here, you can see the gluteus muscles here. You can see the spine, which makes it a lot easier to work and show you what you're doing. Now, some people might be dissecting humans rather than cats. Like I said earlier, the structures between cat and human really aren't as different as we like to believe. When you start doing this, you'll start noticing that the same structures that are found in cats are found in humans. There are certain exceptions with the mammal, and that is if you look at certain rodents, for instance, sometimes they're missing gallbladders, sometimes They have, so if you go to certain other mammals, you see that they have extra stomachs. Now over here, you can actually see the line where the muscles are separating already. This will actually, the more work you do to make sure that everything comes off with the skin, the easier your dissection will be in the long term. Now you're noticing that I'm using, at this point, I'm pretty much using my skin, my own fingers, to take away the skin. Now every so often you get into something hard like this, and so all you have to do is, right, if you notice, I'm using scissors, and I'm using the soft ends of them, the blunt ends. And so sometimes you are going to get these deep tissues which don't, if you know that there's nothing there, you can cut, but what you'll notice is, for the most part, I'm taking everything off via the blunt dissection. And this is all you're going to do when you take off the skin. And I'm hoping to run in a couple, there's sometimes certain problems that end up happening. Now, there are some people who buy pre-skinned cats. If you do, I actually think it's a lot harder to work with pre-skinned cats because a lot of times they're skinned and they leave all the fat on it. Here, you can actually take the skin off the cat relatively easy. And once I get to the front, you'll see how I do the front about the same way. You are noticing that I'm not doing anything with the legs yet. And you'll see why in a little bit. Now, I have a male cat, and the male cats, you are going to have to cut around the testicles to make sure you can take everything off. So all I'm doing is a blunt dissection. If you notice, everything's coming off, and you can already see a lot of the muscles. Now, you can do one of two things. I actually am going to use scissors sometimes, and sometimes scalpels. Some people tell you just use a scalpel and cut around the cat. And what I'm going to have to do is I'm going to have to turn him over. So when you turn him over, you don't have to do as much work as you did on the other side with the scalpel. You're going to use a lot of the incisions already, and I tend to like to come to the jaw here, and then cut across here, and over here, and back around. But there are some people who just have you go through the neck. That's fine. Either way, that's fine. It's a personal preference. I like to see the muscles here under the chin. And again, you're seeing that with this, I don't get a tear in many muscles. Now, if you can, in comments below, tell me why you're using. You can tell me why you're using the video, and if you're doing it to preserve a specimen and taxidermy, this will not be the best way because at the end you'll have a lot of skin, a lot of cuts in the skin. I'm sure taxidermists will be able to tell you a lot better ways to go through this. Now, the reason I'm actually going it this way is you do have the muscles there, but you'll also be able to get through the mouth later and go into the muscles of mastication. And so that's one of the big things. I like to show every muscle I can. There are some people who don't like to deal with the face because of the, well, some people say it's kind of spooky. I figure, especially if some of the people are maybe going into different, oh, there you go. Some people may be going into different types of medical fields. Some of you may actually be dealing with facial structures, so it makes sense. Again, what you're noticing is what I'm using mostly is the blunt end. Now, once I get around to here, it becomes a lot simpler. The reason is you have a lot of skin off, and now it's mostly just taking it off. And you can see it's really not that hard. It doesn't take a lot of force. I'm mostly using my fingers. And what you can see is, again, I'm leaving the arms, and there's a reason behind it. Now, This is actually the hard area here because you get into the chest area, and if you remember, there are certain chest muscles which wrap around the other way. So what you can do is you can start cleaning, here you'll see what I'm talking about, areas where you see muscles. And this way, you will maintain most of the muscles you want. Here on the abdomen, it will be relatively easy, and I recommend going from the abdomen first and then everything else after when you get here. Now you'll see why in a little bit. Mostly, you can see how easy it really is to work on the abdomen. It is hard for people to deal with this, but the thing is, just as it's hard to deal with this, imagine the first time you're dealing with a dead human being. And I'm going to go around here while I talk. I mean, it is going to be hard to deal with someone. The first time you see someone dead, it is difficult. And it's even harder when it is someone you know. So, again, what you're seeing is the blunt dissection techniques being used. So, it can actually go quicker. I have seen some people try to use a scalpel for this entire system, for the entire dissection, and what I found is they tend to go a lot slower than I do. But that said, there are some people who are very skilled with using a scalpel, and they can go faster than I can with the blunt dissection. But I found for my students, for people who have never done this before, blunt dissection works a lot quicker. Now, I am trying to talk. I am trying to go to different angles so you can see exactly what I'm doing. And I do want to I'm actually looking to run into problems. A lot of times when you're doing it quick, you can run into problems, but you've run into them so much that you go without even thinking. Right now, if you notice this side, it tended to go a little easier. That's fine. It does give me the opportunity to show off more of the techniques I like to use. Now, as we get to the end again, if we turn them around, you can now see that we can work on the other side, which I don't know if I'm going to show you both sides in dissection or if I'm going to edit some of this out. But what you're seeing is, how quick it is to skin a cat. And at least one version. Always remember there are many ways to skin a cat, like the old saying says. And yes, those were meant as a joke. I'm sorry. I need to keep it light every so often. One thing you'll notice too is one of the hard things to do when dealing with cat dissection is the smell. It's not that the cats smell, but the preservatives that's used tend to give off a little bit of a odor. And that odor, at least to me, causes a burning sensation in my nose. There are people who use masks. I guess I should, but I choose not to. I recommend my students use them, but again, it's up to them. Some choose to, some don't. And so now we are getting to a point where we can start taking everything off. All I'm going to do is, again, I may do some fast forward so you don't have to see 20 minutes of me playing with the cat. Most of these cats are going to be taken from some sort of humane society, not necessarily humane society, but some sort of pest control type of organization. The reason is people are extremely irresponsible. Some of them have cats, pet cats. They don't plan to breed, but they let them loose outside, and they're not. These cats a lot of times are not spayed or neutered, so it makes for a huge population of stray cats. Now, about here, I'm almost at the end of the abdominal connection. There it is. What you can see is I can actually bring my hand all the way around. Now, once you can do this, it starts getting easier. A lot easier, actually. And what you can do is, you can take all this here, and you can cut it, so you can do the legs and everything easier. It doesn't matter. Like I said, you can or you can't. It's up to you. I tend to like to keep the skin, as much of it as possible, so I wrap it in around the cat again, and that way you have something to protect your cat from dehydrating. If you did anything on skin already, you may have already talked about how one of the functions of skin is to keep water inside of you, and so again, what you're seeing is the taking off of the pelt. Now, when questions come, if anyone has any questions on how I do it and why I do it this way and rather than another way, please put your questions at the bottom, and we'll answer them. Plug my books. I have 3 of them right now. One of them is called Cirrus and the Rarest Things, which is a fictionalized autobiography based on my experience in Okinawa after my father passed away. The other one is called Breaking Points, which is really the first one I wrote, which is how to use anatomy and physiology to determine injuries in martial arts, how to use kata mainly. The other one is called Human Anatomy, a Clinical Approach, which currently is mostly an anatomy of lab activities, where a lot of it is meant to help you understand what you're doing in lab and why you're learning what you're learning. Again, these are mice things, so there are some people who would have you learn less. I tend to have my students learn all the muscles, but what they found is, as I tell them why they're learning something, they tend to do better in the class than most people and remember it. And that's actually the important thing, right? You want to know why you're learning something, so when you go to clinicals, you can actually say, oh, yeah, I heard that, and I know why, the clinical anatomy behind it. I know why I wanted to know about the palmaris brevis, for instance, which is a muscle that gets cut during a carpal tunnel release. So, what you're noticing is I'm now going towards the arm. If I come up here, I will also do some stuff. And over here, you're going to have to cut more because they did sew the neck together. So you want to cut the strings, which will make it easier, if on this case at least, to get all the skin off. Now again, like I said, I like to keep it as a whole. There are some people who don't care that much. There's some people who feel that, well, look, it's really kind of an overkill to keep this much skin. Again, it's a matter of preference in that case. My preference is, and the reason I like to keep as much skin as possible is it preserves the specimen a little more. And once you get to the arms, well, forelimbs, I should say, not arms, but I tend to deal with the cat as if it was a human. A lot of people with pets, though, have made a comment that they are great companions. Now here, you can see it's getting tougher, so I'm getting the scissors, popping them in, and you can hear the connective tissue coming off. Now once you get enough, you can start taking it off like that. And again, what you're noticing is it's not that hard. One of the things that does happen is you tend to hear me breathing more, harder, and the reason behind that is because the smell. It does bother me a little, yes. And anyone who says the smell of the preservative doesn't affect them, well, they're better than I am, I guess. And so what I'm doing again is just using my scissors to break apart any connective tissue that isn't cooperating. Again, you're noticing that I'm taking this entire thing off in one go, and you're seeing how long it really takes me. Now, once we get here, what I'm going to do is I am going to cut up the arm. The reason is, like I said, I want to end up being able to use this to preserve the cat. And so I found that by doing this, I can wrap the skin around the cat afterwards, and it will do okay. Now, again, like I said, with skin, you're always welcome to use scalpel. You'll notice that I tend to like to see what I'm cutting before I cut. And you are going to always have some places which are more stubborn than others. Now once you see one arm being cleaned off, the other one you can do exactly the same way. Again, you can hear the connective tissue. So if I know that there's nothing there that I'm going to want, I can cut. But before you actually just cut, you need to actually know what you're looking for. A lot of the vessels that you're going to see here are going to be veins, and so you don't really worry about it, or small tributaries of arteries. Now, what you're seeing is, again, just how easy this is. Again, there are always spots where they're tight, like here. But all you have to do is put your trusty scissors in, pop it in, then you put your finger in and open it up. So one of the things in my way is you are going to use a lot of your fingers to dissect. So you're going to be putting your fingers a lot into a cat. Okay, now what I'm going to do here is I'm going to take a shortcut. And you can do this if you want. If you're going to be especially if you're going to be working with the muscles of the chest area and back first, you can just cut the skin around here for now. And what that does is it allows you to flap this open, and you can now take off the rest of the skin. Relatively easy. Sometimes you will get some tears, that's fine, especially if you know what you're looking at. He's not going to care if you tear his muscles anymore. This one is a he. So. Now, one of the big things, there are some people who ask you to know the names of the muscles as they are in cats. I figure the class is called Human Anatomy, so all I really care for you to know is the muscles that are found in humans. So for instance, you have some muscles that are unique to cats or unique to quadrupeds. We don't have to know them. Now, every so often you see that I play with something, you'll see that there's a tightness. And you're noticing, again, that I'm not using the scalpel. I'm using the blunt dissection. Now, you can see how to do the forelimbs, we already have a little bit of cuts. We actually can clean it up just a bit more. And once we have a little bit of a glove type cut, here you can see how I am able to lift this up like this. You can now just pull this off. Now there are some people who don't worry too much about the forearms and everything. I like the forearm muscles. There's a lot of interesting things and a lot of damage that can present with these muscles. So in my class, if you're in my class, you will need to know these muscles. So make sure you dissect the skin appropriately. And again, never cut anything you don't know what it is. You can actually see the arteries are dyed in this one. And you clean clean out the adhesions, and you can just pretty much pull it off. This will be a lot easier when you have a partner, because you can have someone holding while you pull, or you can be the one holding while they pull. But even without, you're seeing how quick the forelimbs can actually be done. And there is, again, always a reason for why I do things a certain way. And if you put on the, if you don't understand why I'm doing something a certain way, and you want to know, please email me, or sorry, put it on comments. So now what you're seeing is I can actually have the entire forearm, forelimb, almost out of the cat. Now I do have a little bit of skin here. If you want, if it bothers you a lot, you can take your scalpel and cut around it. The leg we're going to do exactly the same way as we did the back hind leg. We're going to do exactly the same way as we did the forelimb. And again, you'll hear me say leg and arm. The reason is, again, human anatomy, we're going to be dealing with legs and arms. Now, again, I'm going to use the same approach, and you can do this, or you can do a line straight up the middle and clean them up like that. This guy already has been injected here, so we can actually follow that up. Follow that down so we preserve as much structure as we can. Again, you'll notice that I do prefer scissors to scalpel most of the time. Every so often you have tougher skin, so it makes it harder. So, with that, we now have our leg. Now again, if you're doing just the, if you're just going to do the axial muscles, you don't have, you can actually make cuts around here, so you can preserve the rest of the leg. Or if you're like me and like to see all the muscles at once, you can open it up like this. Now, again, right away, you can see that when you use my technique, you tend to get rid of a lot of the fat. And the more fat you get rid of now with the skin, the easier the rest of the dissection will be. It's actually one of the big things. If you, the more work you put into it at the beginning, the less you have to put in at the end. It's just prepared more. Now over here, I'm just going to point something out. You can actually already see the adductor longus, the sartorius, I mean here to here, and the inguinal ligament will be here. That's actually called the femoral triangle, and you can see blood vessels there.